Such a pleasure to be here at Phoenix meeting with some of the meetup hosts for our meetups across the country, and I'm here with Dr. Arthi Chandra, who is from Seattle and doing the meetup there. Tell us a little bit about your practice.
So I have a consultative functional medicine practice at Swedish Medical Center in Seattle, Washington. I've been practicing functional medicine there since about '06. I was a primary care family physician for about 10 years prior and started incorporating this very slowly, kind of quietly in my work. And because it was so effective, patients started referring their friends and colleagues to me, and slowly other providers in our system, primary care doctors, and then over time specialists started referring as well. So we've developed quite a program where we have a 3-month waiting list now without any marketing, and our institution has been slowly working to help grow the program, and we are now going to be moving into a larger space, expanding, and then collaborating with our diabesity program that's also evolving and emerging, and then also doing work with our perinatal folks to impact change in our prenatal and newborn population, and if you impact the newborns, you of course impact children and future adults. So it's very exciting, and and it's great to be back at AFMCP helping facilitate learning for the new folks that are coming on board.
So tell me a little bit about the meetups and what it's been like, having a group of newbies sort of getting in front of this information for the first time.
Yeah, so we hosted at my medical center, we hosted the last IFM Connects event, and it was a hit. We had about 120 people sign up, and probably about 50% of those folks were new to an IFM type of an event. And we had a variety of practitioners there. Seattle is crawling with all sorts of integrative providers, so we had naturopaths and acupuncturists and health coaches as well as medical doctors there, and even a few administrative type folks. So Jeff Bland's talk was well received, stimulating, interesting. Kelly Brogan's talk was also really, people were quite fascinating with her delivery of that topic, and so it was a great networking experience. We actually, out of that, we're going to actually do some separate gatherings to talk about practice management, to talk about patient education programs, so that we are all collaborating, and instead of working in our own little silos, which is clearly what we're trying to move away from in functional medicine, but yet sometimes in our communities we're sort of working in silos for the same cause. And so your forum was an amazing opportunity for us to come together and say, let's work together.
Absolutely. Thank you so much for saying that, because our goal is to really be a force for collaboration, for bringing different groups together for the same mission. There's so much more in common than people have that's different between those different groups that you mentioned. I know you're a facilitator here. How are some of the newbie doctors doing in their first sort of functional medicine experience at the conference?
I think there's a lot of excitement. I've had several people say, I want to do the modules. People are asking what order I would recommend them to do modules in. There's people who are feeling like finally they've found what they've been looking for in order to kind of implement more of a model of care. I think that's the value of functional medicine. I describe it to my colleagues at Swedish as a model of care from which to practice integrative approaches, a science-based, biochemistry-based, evidence-based model, so that it allows for us to move forward with patients with intention and flow and thought and reasonable working plans. And I think, what I'm hearing from some of the new folks is that they feel like they're just going to be better equipped with tools to help move their patients forward on a wellness journey.
So bringing it into a usable framework that's repeatable, I think that's one of the biggest things I see. I was thinking, if we had to suddenly train 100,000 doctors in integrative medicine, then functional would almost have to be the operating system, because those integrative modalities is difficult to know what to do in what order, but this gives you a framework to do it. That's sort of my interpretation of it.
I think you're right on. I think you're right on with that. And, I practiced integratively for about 10 years prior. As a primary care doctor, I've always been integrative minded, always believed that conventional medicine doesn't have all the answers. So I dabbled. I did a little bit of American Holistic Medical Association training, a little training with different practitioners and nutrition and so forth, weekend workshops. Yeah. And so I've always incorporated it, but once I discovered functional medicine, I found that the tools and the algorithms and the systems really allowed for me to really make progress with my patients instead of just a plug and chug random approach. So it was just a huge shift for me on a soul level as well as on a practice level.
So tell me, it sounds like Swedish might be the second Cleveland clinic, a big medical system ready to adopt functional medicine. What's been sort of the journey to get you there? Have you been right in the center of that, I'd imagine?
Well, I have. I mean, I have been the only functional medicine provider there until actually this fall when we were able to get approved for a position for my colleague Jillian Ehrlich, who is also certified in functional medicine, doctorate and nurse practitioner, and also certified in Ayurveda. So she brings a lovely combination of skills as well. And so I've been meeting with folks from Swedish leadership for about three to 4 years, and there clearly has been interest all this time. Our executive vice president got it from the beginning and said, we need to change, our doctors need to change, we need to shift. We need to offer this, especially in the era of accountable care, healthcare reform. We're sort of mandated now to find ways to keep people well and save on cost. And it's just, things happen slowly, change happens slowly. And but, in the last 6 months, we've seen much greater progress and our likely involvement in this new space with what's called the Digestive Health Network. And so it's a coming together of all the different specialties in Swedish that have anything to do with gut health, and which of course includes obesity, diabetes, and so forth.
How big a sort of accelerator do you think it's going to be when the Cleveland Clinic research comes out and shows like the outcomes data, shows the cost data for these chronic diseases that seem sort of, if you think about it theoretically, it just seems to be a better situation in root cause resolution rather than just an ongoing drug protocols?
Right. I think it's going to take hold really quickly. I think there are already hospital administrators and insurance executives looking and listening and watching. The word's out. I mean, it's out there. You see articles in some of the hospital journals and other business journals about this movement. And so I think, and everybody's waiting for data. Many institutions are fearful of moving forward without such data. Even though we have so much clinical evidence, clinical experience, they need of course, the objective data, the science. And so I think that the country is ripe. We need to save money. We need to increase wellness. We need to increase vitality in our population so that we can have a more productive society and reduce the costs that chronic illness confers on our society as a huge burden that it is.
Well, I just want to say thank you from myself and the whole Evolution of Medicine team. One, for taking the initiative to do the meetup. I know that's not always easy, and to just step forward in your community and host, I think is really powerful. I want to say thank you for that, but also just thank you for being on the coalface for all these years to getting there, because I see that trend is emerging, but it's taken the work of you and your colleagues for so long to get us to a point where this makes sense and get to a point where people really take notes. So thank you so much for everything and appreciate it, and we're going to work together
as well. We appreciate it.
Community is the guru of the future. It's happening in Swedish Hospital in Seattle. It's happening all over the country.